I know we talk a lot about athletes and sports and these young guys that are hurting themselves, but today we're going to talk about one of the arguably most, Nick Saban, one of the most successful college coaches in football history, and he's having a hip replacement. What's that? Let's go find out. This is the human body, and what we're going to do is we're going to zoom right in to the right hip, okay? So what you see here is that the hip region has a lot of nerves around there, very important, superficial and deep nerves. And then there's a lot of muscles around there. So let's just peel away all the muscles and then let's see what happens when we are looking right at the hip. And you can see that even there's intrinsic muscles deep within the hip joint, and you've got your pelvic girdle here. This is all your pelvis. There's your acetabulum. So the pelvis comes all the way down here. Okay, so there's the socket. This and all here is your pelvis. The hip joint, and I'm going to draw it out for you here just to differentiate what the hip joint is the ball, okay, and the socket. Now obviously the socket is all the way in here, okay, so you're not actually seeing the socket because it's in 2 dimensions. But the ball and socket rotates, and that movement is what allows you to move your hip in interesting ways. So here's a zoom in of the hip joint. There's your socket. There's your hip. Whoa, look at that. That looks horrible. It looks like the entire femoral head is destroyed. Well, that's what happens. The cup and the femoral head get eroded, and you get these bone spurs all around. So when you move, it doesn't move. Nice sound effects? Yeah, I love it too. So that's the arthritic hip, and what happens with that? We replace it. There's an artificial socket. Now, this could be of any company. This happens to be one particular brand, but there's all sorts of options. You can put screws in there to support it. Sometimes you don't always use a screw. That's the socket. This is the femoral head. There's the stem, and smooth, right? Good. Got it? So, hip replacement. Stem goes into the femur. So, how does this work? You know, is it going to jiggle? Do you wiggle it? Do you move it? Is it going to stay in there? Well, the video is going to go through it, and it's all about the importance of a good solid friction fit or cement. Now, typically, ideally, in a patient with robust bone quality and strength, which sometimes you can't determine until you're there intraoperatively to determine how the fit is, but you can visually and sometimes from analytic methods determine the quality of the bone through various tests, which I won't get into, but I do go into some of my other videos on osteoporosis and bone strength and bone quality. But oftentimes, if you have good, robust bone quality, which we would expect for a person who I suspect was very active in his young age, is now 67, has still been relatively active moving around, I would suspect that unless he has any major metabolic bone disease or other diseases or pathology, that his bone quality should be reasonable. So the plan would be an uncemented total hip replacement by his surgeon. Now, you can't see it here, but it's a scratch fit. Now, there's all sorts of terms for this. Is it trabecular metal? Is it porous coated? Is it just, I don't know what I was going to say. I know.
I would just jump right into that.
Wait for it. Roughened surface of some kind. And that could be just metal. It could be coated with hydroxyapatite, like this white stuff. See, metal is the shiny stuff. This is a white stuff representing the hydroxyapatite. And so it could be roughened in some manner so the surfaces are undulated, or they have porosity where it's more like concrete. Imagine like the concrete surfaces and they have air bubbles in there. Well, that's the kind of material where you want bone to interdigitate. Now, a lot of people talk about osseointegration, integration of the bone into the metal. There's a lot to be said about the science behind that. I'm not going to get into the analytic details. However, the belief is that some form of biologic fixation happens. Now, the regulatory aspect of is it truly osseointegration or biologic ingrowth, we're going to leave for a separate topic altogether in my regulatory section. However, the important thing is you want this to fit with a tight press fit or some kind of friction. So once you push it in, it's not something that'll just pull out like that. So clearly this is acrylic plastic. This is relatively smooth. But when you put it into bone, the bone, and you'll see this on the video and in the anatomical descriptions of cortical and trabecular bone that I go through, you'll see that it's a press fit. So you fit it so it matches and you get your leg lengths reasonable. And then the socket as well is also press fit. And if it's not perfectly optimally suited in terms of stability, you have some holes that you can put a screw in. Once that's in, you put a plastic socket in there, liner, the hip is then reduced, and then it moves smoothly. Do you hear anything? I don't hear anything. That's polished, smooth, ceramic or metal on plastic. We don't do metal on metal anymore because of all the issues that came up with metal on metal. And ceramic on poly, in my opinion, has a very good volumetric and linear wear. So I tend to prefer and like to put ceramic, which is a ceramic material, on polyethylene, which is the plastic. But metal on plastic is still the standard and still has great wear. Now, he's 67. I'd put a ceramic on poly on him, and that would do him very well. Or ceramic on ceramic does really well, but we tend to reserve those for the 40-year-old or younger that have severe dysplastic hips that end up having an early hip replacement because the volumetric wear overall is very low in general because the linear wear is really low. So in the end, the ultimate choice for an arthroplasty is between you and your surgeon. And that conversation has been going on between Nick Saban and his surgeon to determine what's the optimal geometry, fit, implant choice that he would like. And sometimes it's based on surgeon choice. I mean, we're not expecting you as a patient to know what all the technologies are out there and which is the best for you. And sometimes that's where you have to have faith in the surgeon as well as what the surgeon is comfortable with. Because if you have a high experienced, good quality surgeon available that uses a certain implant, you probably want to go with what he does best. And so that is ultimately between the patient, Nick Saban, and his surgeon. Now, 67 years old, let's assume he's healthy, no major medical comorbidities. He should probably get 15 to 20 years out of it. You guys remember Bo Jackson? He didn't last very long in his hip replacement because he was running, impact loading, and pounding the bleep out of that hip. That's unlikely the case with someone older, 67 or older. Many patients ski, many patients are active, hiking, doubles tennis, even with a hip replacement. But it doesn't mean that their life is over after a hip replacement. We have good technology out there. It's getting better. And so I suspect, based on the surgeon of choice and Nick Saban and the quality of care that orthopedic surgeons can offer now, he's going to do great. Now check out this video. You're going to love it.
Hip arthroplasty is a surgical procedure used to relieve the pain and loss of joint mobility associated with osteoarthritis, rheumatoid arthritis, and other forms of arthritis. These conditions involve loss of joint cartilage and wearing of the bone, causing restricted mobility and pain. Total hip arthroplasty involves the replacement of both the femoral head and the acetabulum of the hip. The arthritic head of the femur is exposed, removed completely, and shaped for the stem of the stainless steel femoral head replacement. Polymethyl methacrylic cement is applied to the channel created in the femur for the stem. The stem is impacted into the femoral bone, being fixed by the cement, and the head is attached to the stem. Similarly, the acetabulum is shaped, and a polyethylene lining cup is applied to the acetabular shell and fixed with cement. Natural range of motion is replicated by the non-abrasive articulation of the acetabular shell with the metal head of the femur.
And if you have any questions, leave them in the comments below, and I'll answer them as soon as I can.
I got bones